Hi guys. So I'll just wait for some of the viewers to join before we start. So since this is the first time I'm actually doing a live stream session, does someone mind just typing a question on the chat window just to make sure that I'm getting it? Okay, perfect. So I think that the chat works. So I'll just wait for a few more viewers to join before I start. Okay. I'm just making sure it looks good on my screen as well. Okay, guys. So while we're waiting for users to or viewers to join us for this live Q&A session, I'll just give you a brief introduction about myself and just so that you have an idea of what my background is. So essentially, I grew up in Canada, and I did all my elementary school, high school, undergraduate, university in Canada, and essentially my undergraduate degree was in engineering. And partway through my engineering degree, I realized engineering wasn't really what I was truly cut out for. So I always had the idea of doing medicine from a younger age. So essentially, what I after sort of in my third and fourth year of engineering, I realized this probably wasn't for me. So eventually, I graduated from engineering and I started working at a telecom company in Toronto, and that's when I sort of uh, made up my mind to switch careers into medicine. So I initially started applying to medical schools in around Canada, and although my marks were okay in engineering, they weren't exceptional. Just because engineering is a very hard degree, and so what I ended up doing was I applied to a foreign medical school. So I eventually ended up at the University of Sydney in Australia. And so that's where I finished my medical school degree. And so for me, I was considered, although I was pretty much raised in Canada and pretty much grew up in Canada, I was still considered an IMG in the sense of applying back to Canada for training. So I sort of went through the whole process of what you guys are going through right now in terms of getting my CV ready, applying through Carms, making sure I had my Mcc Qe1 and Mcc Qe2 done before my applications. And so that's how I ended up sort of in the IMG pool. So for me, I essentially spent about 7 years in Australia. 4 of those years were in medical school, and then about 3 years I spent working as a junior medical officer in Sydney, and then eventually I applied back to Carms. And I was fortunate enough to secure one of the spots in anesthesiology in Ottawa, and so I spent about 5 years training in Ottawa in anesthesiology, and training in 2018, in June 2018, and then finally made it back to Toronto, where I currently work as a consultant. So if you guys have any questions specifically about sort of the process of, or anything related to IMGs, so if you have any questions about the Mcc Qe1, the NAC just about medicine in Canada, what life is like here, please feel free to send me a text, and I'll try and answer them as best as I can. Okay, so one of the questions I just received is, what's the best way to get a Canadian letter of reference during the pandemic, especially when volunteer work and observerships are closed? So to be honest, it's going to be really hard to do or get a very solid letter of reference if you can't spend time in the hospital, because a solid reference letter will only come about if you're able to spend some quality time with a supervising physician, and they can see how well you interact with patients, how well you interact with other physician colleagues. So this is a pretty tough question. The only thing I can suggest is, one is perhaps waiting till this pandemic slowly gets better and in-person observerships are offered again. That's one option. I know it's a difficult answer for many to hear, just because a lot of people want to apply for the next Carms session, and you need to have your reference letters in by a certain time. Other things I would suggest is potentially, what else can you, yeah, so it's really hard to get a good reference letter if you're not in the hospital in person. Other things you may want to consider are maybe volunteering somewhere else, maybe not in a hospital, but volunteering like at a research lab where there are physicians working there, and maybe you can get a reference letter that way, where you're not actually in a hospital environment, but more in a research environment. Because a lot of physicians that work in Canada, part of their job is clinical medicine, but part of their job is doing research in a lab. So you may be able to interact with them in a lab setting. I know it's not an easy way to get a reference letter, but that's probably another option. But again, this pandemic has disrupted a lot of people's lives, and I think this is part of the situation. It makes getting good reference letters pretty difficult. So the next question I'm seeing is, for Ottawa Medical School, is it important to have publications or research experience? So I would say it is very important, because a lot of, if you're just talking about applying to medical school, a lot of medical applicants these days do have publications and do have research experience. So you essentially are competing with the pool who's applying currently. And a lot of students are trying to pad their CVs with research, publications. And so in order to be at least competitive or in the same level as your colleagues who are applying, I would recommend making sure you at least try to have a research project sort of underway, and something that you could explain that potentially it could be published. So even if you haven't published it yet, because publishing something is quite difficult in terms of you have to send a manuscript that has to be peer reviewed, and then you'll get feedback about the publication. You may have to make some changes and then resubmit. So it's quite difficult to get a publication, but at least get some research underway with maybe some reputable professors or clinicians, and have that on your CV with written as you have the intent of publishing the results, and that would probably go a long way in terms of your application to medical school. So the next question is, I have a question regarding year of graduation. I graduated in 2010. Do you think it's a good idea to pursue exams and have some recency and apply. So in general, the answer to this is the further away you get from the year of graduation from medical school, the harder it is to match to a Carms residency spot. The reason being is that every year that goes by, there's a wave of new students coming into the pool, and they're also now going to be your competitors in terms of the application. So ideally, what you want to do is try and match into Carms as soon as you. So for my situation, I had graduated in 2010. I spent about 2 years working as a house officer in Sydney. And then in 2012 is when I applied. So basically 2 years after. And then 2013, I matched and I came back to Canada. So the ideal situation is you want to try and get into the Carms process as soon as you graduate. But again, I know this is difficult for some people just in terms of you may have had life situations or not being able to get permanent residency in Canada right away. So there is a delay. And when I matched into Carms, I did meet a lot of other candidates who matched into family medicine, into radiation oncology, who were far from their medical school graduation. So one of my friends who actually graduated, I think in 2005, so they were about 8 years away from their medical school graduation, and they had matched into radiation oncology. So it's not impossible. It just makes it a lot harder for you to potentially match because you're sort of competing with all these recent graduates. And most residency programs in Canada want you to be very close to sort of either your graduation or close to work experience as a clinician. So even if you've graduated in 2010, if you have some experience that you've been working in another country as a junior doctor, as like a house officer or some sort of clinician, that would be good experience to show on your resume, to highlight that you're very close or in touch with clinical medicine, you're in touch with being in the hospital environment. So I don't think that should stop you if you've graduated in 2010. So I would encourage you, at least by study, if you have the time, study for the exams, write the Mcc Qe1, the NAC-OSCE, and other than the time commitment and a little bit of money that you need to use for the applications, you don't really have anything to lose by applying. So the next question is, so I know you wrote the Qe1 a while ago, but I was just wondering if you used Toronto Notes, Canada QBank, and how you specifically studied for the clinical decision-making portion. So essentially, the way I went about studying for the Mcc Qe1 was I initially used my medical school notes to make sure. So I had essentially written the Qe1 probably about 2 or 3 months right after I had finished my medical school final examination. So a lot of my medical school notes were very fresh in my mind. So what I used was I re-reviewed all my medical school notes. And then basically the only resource I personally used was the Canada QBank. I felt that for me, the Canada QBank was enough information to sort of learn the clinical decision-making portion of the exam. Again, it's very subjective, and a lot of people may find the Canada QBank does not work for them. So the other resource that a lot of people recommend is UWorld. But for me personally, I thought the Canada QBank was enough. So the only things I really used were my medical school notes, Canada QBank, and then I used the Toronto Notes just as a reference. I didn't actually read the Toronto Notes from cover to cover because there's a lot of details in the in Toronto Notes that are not really, they're just blank information and they don't really relate it to medical context. It's just basically point form notes. So use the Toronto Notes as a reference, but all you really need is a Canada QBank and a medical school notes. So the next question is, can you give tips for writing a good personal letter? So essentially tips for writing a good personal letter would, so there are several things that you need to do. So there's a lot of things that in the personal letter you can write that are very generic, and a lot of the candidates are going to essentially use that same sort of framework. So what you need to do is try to be different, something that sort of catches the program director and the selection committee off guard, something that's different, right? So me personally, when I did my personal letter, like most people are going to essentially use the, use the structure of, why they wanted to do medicine, why they want to do the specialty, and what they're going to bring to the program. So ideally, the personal letter, you want to essentially highlight why you're going to be a good candidate for that program. So things that you could potentially use in your personal letter are, in medical school, what are some personal experiences you had that pushed you into choosing the specialty you decided to do? So for example, in anesthesia, one of the things I felt when I was doing my anesthesia rotations was that, so in Australia and Canada, the anesthesiologists are involved with trauma care, right? So if a critical patient comes in to the hospital, one of the members of the trauma team is the anesthesiologist. And what they do is they're at the head of the bed, they're managing the airway, they're making sure the patient is hemodynamically stable. And also, for me, what I thought as an anesthesiologist is this person that's coming in from a very devastating trauma, this is the worst day of their life. So one of the things I talked about is how, as an anesthesiologist, a lot of people think that we don't have much interaction with patients because most of our patients are unconscious, or we don't have any continuing care with our patients because we see our patients in the operating room and then that's all. We never see them again. So what I talked about in my personal letter was one of the reasons I wanted to do anesthesia is because you can take care of a patient in one of the worst days of their life. By being at the head of the bed, you're able to communicate with that patient, reassure them, make sure that they're comfortable, give them pain relief, and then also communicate with their family about how that patient was, what you talked to them about, and it's sort of a psychosocial thing, right? So these are some sort of things that you could take away from an anesthesia point of view. So you could sort of look at that in other specialties as well. So, maybe you want to talk about, like if you're applying to radiology, you can find some unique thing about radiology and why that is a special field and why you enjoy it, and sort of relate that to your personal statement. And I think that'll make it a bit more unique than the usual standard thing of, you want to do radiology because you enjoy anatomy or you enjoy computers. Those are usually the stereotypical answers that people usually give. And with anesthesia, the stereotypical answers are going to be you like physiology, you like pharmacology. So you probably want to stay away from the stereotypical answers and try to find something unique about the specialty that makes it special and sort of related to yourself. So you can say maybe you were involved in, a trauma, or one of your family members was involved in a trauma, and you found that the anesthesiologist was a very crucial member, and you want to sort of use that sort of experience to highlight why you want to go into the specialty. Anyway, sorry, I think I rambled on that question. Yeah. So let me go to the next question. So the next question is how to get into a research program here in Canada while preparing for the Mcc Qe1. So it's a little bit difficult in terms of getting into a research program, but the best way I could say you could get into a research program, because I've seen other students do this, is usually if you do an elective or an observership, the best way to do this is when you go for an observership or an elective somewhere in Canada, you have to take that opportunity as not only, doing the specialty, but your job in that observership is to network with every single person you meet. So, for example, I always tell some of the students that are coming into from overseas who come in to do an elective at my hospital is don't just talk to the anesthesiologist. If you're talking to the internal medicine person about a consult, introduce yourself, tell them who you are. You're coming from India or Pakistan or I don't know, the UK, and you're here as an elective, and this is your name, and you'd love to meet up with them. So one of your jobs on your elective in Canada is to make sure you network with as many people. So network with the internal medicine doctors, network with the surgeons, network with any physician you come across, introduce yourself, tell them what your intention is. And most of the physicians in Canada realize that coming back to Canada as an international medical graduate is very difficult. And everyone in Canada is totally friendly and very open-minded in terms of having someone introduce themselves and then giving them the opportunity. So that's what a lot of students do. So they network while they're in either an observership or an elective. And then once you sort of know these physicians, you have to keep in touch with them. So, every couple of months, just tell them what you're doing, that you may just email physicians or researchers and tell them, if you have a research project, I'd love to collect data, I'd like to analyze data. So, as a medical student or a recent graduate, you're not going to be leading a huge project. Your job is to try and get your name on any sort of research. And to get your name, you need to do something, even something trivial. This might be entering data into an Excel spreadsheet or creating a macro on an Excel spreadsheet to add up certain tables. So these simple things are just going to get you involved in a research project, even in a very small way. And that way you'll get your name onto a research project. And then when you go to present it, like you put that research publication on your CV, and then when you go to an interview, you sort of highlight the research and sort of make it more than you actually did. I know it's a little bit, I'm not saying it's misleading, but even though you've just entered data into a spreadsheet, you have to make it look like you were more involved in that. And I don't mean to say mislead anyone, but that's how things work. So yeah. So the next question is, how about fellowships in family medicine for IMGs? So, fellowships in family medicine, there are very few of them. So the way family medicine in Canada works is you essentially do a 2-year residency. So most people, what they do is they finish medical school, either in Canadian medical school or in overseas, they do a 2-year residency program to become a family doctor. Now, there are a few fellowships, but they are very, very, very competitive. And these fellowships are in emergency medicine. So you do an extra 1 year in emergency medicine. You can do an extra 1 year in anesthesia. And there's another one, you can do an extra 1 year in palliative care. So those are essentially the 3 family medicine fellowships that you can do. But they are very competitive, and generally they're only open to physicians who've done a family medicine residency in Canada. So the next question is, have you heard of students getting elective letters while doing an observership, and is that feasible? So I have heard of students getting reference letters that were targeted for Carms as an elective while they were doing observerships. It's very difficult, but you can get it done if you build a good rapport with your supervisor and tell them what your intent is and be open with them. Tell them, listen, I graduated 3 or 4 years away from medical school, and I don't have any electives in, for example, specialty X, and that's why I'm here doing an observership, and I want to apply for Carms, and they require a reference letter. Would you be happy to provide this for me? And if you're frank with, or if you're very honest with supervisors and tell them what your intent is, a lot of them are very reasonable, including like myself. I've been a supervisor to a few observership students, and I've provided reference letters for these individuals. And I don't necessarily write that it was an observership. I don't even write that it's an elective. I say they came in for 4 weeks to experience a rotation in anesthesiology. I leave it like that. So I leave it open. I don't say it was an observership. I don't say it was an elective. I say they worked under my supervision to gain experience in anesthesiology at XY hospital during the period of June 1st to June 30th. And I leave it open. And usually those reference letters are generally sufficient for a Carms application. So the next question is, does it hurt that interest is in family medicine, but work and publications are in oncology research? So no. So generally, your research experience, I mean, if you had research in oncology and you were applying for some oncology training program, that would be ideal. But if you're applying to family medicine and all your research is in oncology, that is not a bad thing, because what your program director is going to look for is not the actual research that you completed. Is what they want to know is, this is a person who is capable of doing research. It doesn't matter what sort of field that research is in. This is a person who is has the methodology to do research, has the patience to do research, has been successful in publishing something. That goes a long way. So it does not matter. If you did research on, I don't know, training dogs, and you had that published in a paper, that would look really good for a Carms resume, because it actually just shows that you're capable of doing something from beginning to the end and getting it published in a reputable journal. So it's actually a good thing. So the next question is, how should I approach getting a letter of reference from an observership or elective? And should they tell the supervisor before the elective begins or towards the end of the program? So this is a very easy answer, and everyone appreciates a candidate who comes in and is honest, and this is a very easy answer. I would say 100% when you first speak to your supervisor, they're generally going to meet with you on the first day or the first couple of days, and they're going to ask you, what are your goals for this observership or elective? That's going to be a standard. In any Canadian hospital, you're going to meet with your supervisor, and one of their questions is going to be, what are your goals for the next 2 weeks or the next 4 weeks while you're here? So at this point, you're going to tell them, okay, what are your goals? Maybe you want to learn, how to write documentation in the way Canadians write documentation in the computer, in the electronic medical record. You want to tell them, maybe you want to learn how to intubate. You want to get more proficient in managing acutely unwell trauma patients. Then you're also going to make sure you tell them your intent is to apply for a residency program in Canada this year. So in August 2021, I want to apply for residency, and I would appreciate if I could get a letter of reference from you based on my performance in the next 3 or 4 weeks. That's what I tell them. And I would say 100% of your supervisors are going to appreciate that you tell them early on, so that as you work for the next 3 or 4 weeks, they're going to be paying attention to what can they write on your reference letter to make you look good. So they're going to be like, okay, Dr. So-and-so knows his pharmacology really thoroughly. Dr. So-and-so is a very good team player, because they're actively looking at you and observing you during your observership and seeing, okay, you are a good team player, or what can you improve on? Maybe your handwriting is really messy. That has to be improved. So they're going to be actively looking at you over the next 3 weeks to write a good reference letter. So 100% make sure you tell your supervisor early on what your intent is and that you want a reference letter. Let me see where the next question is. Okay, the next question is, does Carms have a preference in terms of medical grads, Australia versus Ireland versus UK versus Caribbean versus India, Pakistan? So formally, on the record, so Carms is just an organization that is like a central body that distributes your application to all the various universities. So it's not Carms that decides whether you get an interview or whether you get a residency spot. So that takes in all your applications and then sends them to the various universities that you've applied to, okay? So that's the first thing. So now I guess your question would be, do schools or do medical schools have a preference on medical grads? So the politically correct answer is no, they don't have a preference, but in reality, they do, okay? So this is what I'm gonna tell you, and it's not to discourage anyone. I want to be honest with you guys so that you're not, trying to, you're not trying to chase something that is impossible, okay? So I'm going to give you the honest answer. So in reality, the first preference that Canadian medical schools have is the candidate generally. So in the past, when I look at all people who've matched in the past, is they target, so we're only talking about international medical graduates, okay? So they generally target international medical graduates who are Canadian, who've grown up in Canada, who've gone overseas just for 4 years, and then are now trying to come back to Canada. So these are people, one, like myself. So I grew up in Canada pretty much from the age of 5. I went to elementary school here. I went to high school here. I went to undergraduate school here. I have pretty much grown up in Canada. I know how everything works in Canada. And I literally just went overseas to Australia for, initially I thought I was going to go there for 4 years, but it ended up being 7 years. And I came back. So I sort of knew everything, and I knew the way the Canadian system worked. And so that's ideal. Generally, they prefer a candidate like that. Then after that, it's the actual IMG, like IMGs or candidates who've gone to high school in India or Sri Lanka. They've done their medical school in Sri Lanka, and now they're migrating with their family to Canada. They're not as highly preferred as the actual Canadian IMG who's just gone over for medical school and is coming back. So that's the number one thing. Then in terms of what country you're coming from, again, there's no written preference, but in general, when you look at the people who match back into Canada from overseas schools, they have always been almost in this order: is the UK and Australia, That's the first thing. We can, and I'm not talking about the United States because the United States is not considered an IMG. A United States grad comes in as a Canadian grad, so they're not part of the IMG pool. But if you look at true IMGs, the first one together, it's going to be Australia and the UK, and sometimes Ireland, but Ireland not so much. But okay, we can say Australia, UK, Ireland. That's the first one. Then a lot of the Caribbean people match into Canada as well because they are not actual IMGs. They're people who've grown up in Canada, pretty much spent their entire life in Canada, just went to the Caribbean for 4 years to do med school, and then they've come back. And then finally, the last people that are sort of preferred are other IMGs. So India, Pakistan, Sri Lanka, Russia, Ukraine. Those are sort of the last sort of tier in terms of when I've looked at the stats of people matching. Generally, that's how it's gone. So hopefully that answers your question. So the next question someone asked was, how about Quebec? So I don't know exactly what your question is, but generally Quebec, other than McGill, all the other Quebec programs, you need to know how to speak French pretty much fluently. So if you can't speak French, don't even bother. And then McGill University, if you're applying as an IMG, there are very few spots at McGill. And for a lot of the spots, you may have had to be a Quebec resident to apply. So I don't know much about Quebec. I could have a look in more detail about it, but I don't want to give you any false information because I don't know much about terms of Quebec and how exactly their candidates work. So the next question is, I completed my postgraduate diploma in pathology from India. I didn't have any clinical experience. I want to pursue a career in pathology in Canada. How should I proceed? Okay, so if you have a postgraduate qualification in another country and you don't want to go through the Carms process, there are other ways to try and get a license to practice here, but it's a little bit difficult. What I would suggest is, so in Canada we have, I think we have 10 provinces, three territories. So each province has a different way or a different organization that provides a license to practice medicine. And each of those organizations is the final sort of organization that allows you to practice medicine. So there's what's a system called practice assessment. So each of those sort of licensing bodies has a different way to assess your qualifications and whether your qualifications meet their requirements. So what I would suggest is I can put a link later down onto the actual medical registration or licensing bodies in each province, and you can go look up practice assessment. And essentially practice assessment, what they do is you have to, you still have to write the Mcc Qe1 and the NAC-OSCE, and then you send them all your qualifications. So you send them your medical school degree, you send them your postgraduate qualification. So you're saying in pathology from India, you send them your work experience details. You send all this package to that medical licensing body. They will review that. It'll take several weeks or months to review that. And then they'll let you know whether they accept your qualifications. And once they accept your qualification, then you need to find a job, so a pathology job, where you work supervised for 3 months or 12 weeks. You have to work supervised under an assessor, and this assessor will assess the way you practice medicine in your chosen specialty, so in pathology. and then they'll give a report back to that licensing body saying, okay, Dr. So-and-so is appropriate and is fit to practice medicine in their specialty in this province, and then you can get a license that way. The biggest hurdle is getting all your qualifications assessed. So if the licensing body is not happy with your postgraduate qualifications, they may say, no, we don't accept your current qualifications. You may need to go through Carms and retrain. So just following up with the same question, is it necessary to gain some clinical experience? So the clinical experience that you had in India after your pathology diploma, that would go towards your assessment. And then once, again, like I said, once you're in Canada, after you've been assessed, if they accept your qualifications, they will make you do a minimum of 12 weeks of supervised practice to assess you, to make sure, in fact, you're qualified to work in that province. So each province, like BC, Alberta, Manitoba, Nova Scotia, all have their own sort of clinical assessment processes. So you have to contact each of the bodies to see what exactly they want. The one place that I don't know if they have is Ontario, the province that I work in. It's probably the most populous province. So getting practice assessment in Ontario is very difficult. You may have to either retrain, or you may have to get like a university appointment and then start working. But Ontario is very difficult to get practice assessment, especially from India. So I'll just wait for any other questions that you guys may have. I think we have about 16 people on the chat group so far. So I think in terms of the next question is about gaps in your timeline on your resume and how to explain it to Carm. So I think generally the way you should probably explain it is to be honest. So a lot of people, especially when you're applying through Carms, the program directors who are looking at your resume know that it's not an easy road to come from a foreign country and start to practice medicine in Canada. So a lot of them know that you may have had to be away from clinical medicine for a year because you were waiting for, I don't know, a permanent residency to arrive, or you were waiting for something else to happen in order for you to get to Canada. So I think the best way to approach this is just to be honest with why there's a gap in your sort of timeline, and then try to show it in a positive way, such as, for example, you can say that while you were waiting for your PR to arrive from Canada, you continued your sort of medical, you continued your medical education by ensuring that you kept up with the latest research by reading the Journal of Anesthesiology. You could say you took part in research, helping so-and-so do this. You volunteered at Hospital XYZ, showing cancer patients what they could expect from their treatment. So you can be creative about that. So although you were not directly working as a doctor, there's a lot of other opportunities that you can say you were still sort of involved in medicine. Again, keeping up with the latest research, reading journals, volunteer work, doing research. So you can always fill your gaps that way. So the next question is it even worth to apply for Carms without Canadian letters of reference. So it depends which country. So ideally, you want to have a Canadian reference letter, because what the Canadian reference letter is going to do is, so one, the Canadian medical field is a very small community. So a physician in Ontario, although they wouldn't know Dr. X in British Columbia personally, they would know the hospital they work in. So if Dr. X gives you a reference saying so-and-so was a great candidate, it's very reputable for that doctor to say, in British Columbia, to say this doctor worked at the level of a Canadian graduate or far exceeded the level of a Canadian graduate. So it just goes a long way for them to be able to compare you to an equivalent Canadian graduate. So that's why I say it's always good to have a Canadian reference letter, at least one of them. Now, if you don't have a Canadian reference letter, it really depends on what country you're coming from. So if you're coming from the United States, if you're coming from the UK, coming from Australia, where medicine is generally practiced in the same way as Canada, then those reference letters would definitely go a long way in Canada. So if you had a reference letter, if your reference letters were only from the UK and Australia, they would be really useful in Canada, because a lot of medical practice in Canada and the way society runs is very similar to how things are done in Canada. But that being said, if you're coming from a country like India or Russia, where medicine may not be practiced exactly the same way as what it is in Canada, then those reference letters may not be as powerful or make as much of an impact on the selection committee. So that's why I say always try to aim for either a Canadian reference, or if you can get a Canadian reference, somewhere reference from the United States, Australia, UK. Now, if you don't have any access and you can only get a reference from your home country, so the European Union, I think that would, like, if you're talking about the European Union, even any European country, again, I think the standard of medicine and the way medicine is practiced is quite similar. So I think a European Union reference letter would actually be, I would say it would be pretty useful. So I would still apply to Carms as a European Union reference letter. So the next question is, would residency programs consider research experience from back home, Indonesia? So I think, like I said before, I think any research experience would be valuable on your Carms application. And if that research was published in a high impact journal, that would be even more valuable, because as soon as that research is published and been peer reviewed, you know there's some quality in it and the work is legitimate. So ideally, you want to have research that's been published in a high impact journal. And then even if you haven't had that published, if you say that you intend to publish this research in the journal of XYZ, I think it would still look good, because it shows that you've put in some effort into doing something outside of just clinical medicine. So what do you think about, the next question is, what do you think about the clerkship program offered by some medical schools for IMGs? So I'm not really aware of any clerkship programs offered by medical schools in Canada specifically, but if you could give me a bit more details, I could give you some feedback about it. So the next question is, I had completed residency in internal medicine in home country. I was wondering if I should do NACOSCI and apply to Carms in Canada, or best take Mcc Qe1. So it would depend on where you did your internal medicine residency. So if you could give me more details about which country you did your internal medicine residency, I could probably give you a bit more guidance about it. So the next question is, why is research so important for Canadian programs? So the reason why research has become more important for Canadian programs is it essentially just sets you apart from the competition. So as each year goes by and the competition to get into an IMG spot in Canada gets more intense, people are just adding more and more onto their resume. So you're an applicant who got in to an IMG spot 10 or 20 years ago, with that same application would not be able to get into that spot now because the competition has just gotten much more fierce. So the reason why I emphasize research as being important is it's a powerful way to highlight or enhance your application, because not a lot of people are able to do research and take it all the way up to getting it peer reviewed and published. So as soon as you have that on your resume, it already sets you apart from a lot of the herd applicants, right? So for example, in Canada, residency spots are so competitive. So I'll talk about the anesthesiology. So when I applied, there were only 6 spots for international medical graduates in Canada. And of those 6 spots, my program directed me, about 900 people applied for those 6 spots. Okay? So in that type of competition, you need things to set you apart. So the things that are going to set you apart are research that's been peer reviewed and published, Canadian reference letters, Canadian electives, if you had an amazing award that you were presented with. All these things are going to be small components that just enhance your application and set you apart from the competition. So that's why I think research is important. So yeah, so so I'm just going to answer Asma's question about whether she should apply to Carms for internal medicine or try to get practice assessment with a internal medicine residency from an Arab country. So realistically, to apply for, so the 3 exams that you talked about, Mcc Qe1, the NAC-OSCE, and Mcc Qe2. So most recently, the Mcc Qe2 has now been officially canceled. So the Mcc Qe2 no longer exists, and you no longer need to write that for any sort of application. So ideally, what I would do is getting your credentials sort of approved from an Arab country may be difficult, just because I've seen other candidates attempt to get anesthesiology credentials sort of approved in Canada and they've been rejected. So I think the best thing would be to, if you're very eager to work in Canada as a physician, for both ways, you need to write the NAC-OSCE and the Mcc Qe1. Whether you're going to try and do practice ready assessment or through Carms, you need to write the NAC-OSCE and the Mcc Qe1. That's a minimum. So if you're really eager to work in Canada, I would write those exams, get those 2 exams out of the way. And then once you get those 2 exams out of the way, you can get your credentials sent to whichever province you want to try and work in and see whether they approve it. If they approve it, you're good. You've now gotten through the biggest hurdle. Then you just do the 3 months of supervised assessment. And if you pass that, then you're done. You've gotten your license. if by chance they reject it, then at least you have those 2 exams and you're ready to apply to Carms. So that's what I would do. Okay, I think so far I've answered most of the questions. So if anyone has anything else, it's been pretty much an hour, so we can maybe continue going for about a little while longer if anyone has any more questions, or if everyone sort of finished with their questions and think of something else, you can always send me a message on or leave a comment on this, and I can try and answer. And I'll see if I can try and maybe do a live session every couple of weeks or every month or so to help anyone who has any other questions. And the other thing is this YouTube channel, I only recently started it back in January. And the reason why I started it is primarily because of the pandemic, where I just needed a hobby to do. So that was the reason. But now I'm trying to grow it. So other than my IMG sort of related topics, such as the Mcc Qe1, interview skills, and the NACOSCI, I may end up doing something like, what it's like to work as a physician in Canada and sort of topics that may be interested. So if you guys have any ideas for any future videos that I could do, or things that you would be interested in seeing related to medicine and the medical practice in Canada, please always feel free to send me a message through my YouTube comments, and I'll see if I can do a video to help you guys out. So the next question is, do you know any IMG ophthalmologists in Canada? I've always been wanting to become an ophthalmologist, and Canada seems to have the best pay for that job, but it's very competitive. So I personally don't know any IMG ophthalmologists in Canada. I know literally probably 3 ophthalmologists in Canada, and all of them have trained in Canada. So it is very competitive. You're very right. So I think across the country, ophthalmology pretty much only has about 12 to 15 candidates, and that includes IMGs and local graduates. So there's only 12 spots across the country for ophthalmology in Canada every year. So it's probably one of the most competitive specialties. And then coming in as an IMG, it's even way more competitive. And you are right, the pay is very competitive, and it is a fairly good lifestyle. In general, most physicians in Canada will have a very good pay and a fairly good lifestyle. Thanks for the feedback, guys. I appreciate it. So the next question is, I'm an IMG pediatrician living in Argentina. Do you know of any IMG pediatricians? And what about the possibility of getting a post in a pediatrics residency through Carms? So it's definitely possible to get a pediatric residency through Carms. Again, you'd be coming in as an IMG. So just to go over some of the details about pediatric residency. So it is competitive. Like pretty much all specialties in Canada are going to be competitive as an IMG. The least competitive is obviously family medicine, because they have the most number of spots. I think they have about 150 spots allocated for IMGs versus all the other specialties. So like anesthesia has 6, general surgery has 4 across the country. For pediatrics, I think it's probably about 15 to 20 spots across the country. So it's still fairly competitive, because you have about 1,500 people applying for 15 spots. So it's very competitive, but again, someone has to get those 15 spots. So that could be you. So it is possible. Again, like I said, a lot of the IMGs. So initially I told the group, a lot of the IMGs are Canadians who've been pretty much raised in Canada, who've gone overseas for 4 or 5 years for medical school, and are coming back, and they're considered IMGs. And those are most of the people who get those initial spots. But I do know many real IMGs who are coming from South America, from Southeast Asia, who get matched into these spots, and it is possible. So the only way you can find out is by applying and seeing how you do through the applications. The next question is, I would like to know if it's difficult to get an observership before applying to Carms. So generally, it's been pretty easy to get an observership in Canada. But more recently, because of the pandemic, a lot of the sort of electives and observerships have been put on hold, just because they don't want to have extra bodies in the hospital that are not doing like crucial work in the hospital, just to minimize the spread of COVID-19. So over the last 12 to 15 months, a lot of the observerships have been put on hold. But I think as the vaccinations start to bring down COVID-19 numbers in Canada, the observerships and the electives will start opening up. So you should constantly keep messaging and seeing when they open up, and then you'll hopefully get an observership spot. Okay, so the next question is, observerships are one of the best ways to get a letter of reference. Can you give us information about which hospital or clinic offers observerships and programs? So essentially the way training programs work in Canada is each university or each medical school that each medical school that trains medical students, they also have a residency program. And those residency programs are where you're going to be able to get an observership or an elective. So the best way to sort of find an observership is Google up Canadian medical schools. Okay, so if you Google Canadian medical schools, you're going to get a list of medical schools in Canada. So the province where I work in is called Ontario. And in Ontario, there's about 5 medical schools. And that's the best way to get an elective. So if you go to, for example, University of Toronto, and you want to do an elective in anesthesia, go on Google, type in anesthesia, University of Toronto. The first link that's going to come up is going to be Department of Anesthesia at the University of Toronto. As soon as you click there, I can guarantee there's going to be a link for either electives or observerships or department administrator, some sort of email link. Contact that administrator, and they're going to be your number one resource to say, just contact them, introduce yourself, tell them you're a potential physician coming from overseas and you want to do an observership. How can I go about setting this up? If they don't give you the exact details of, here, pay your fees, they're going to guide you in the right direction of where to get that observership. So what were your main turning points for choosing Canada over the USA, as you've mentioned in a previous video? So the reason why I chose to come to Canada was because Canada has always been home for me. So I pretty much grew up in Canada. My family lives in Canada. A lot of my longtime friends are in Canada. So that was my primary reason to apply to Canada for training and then hopefully eventually live here. So that's my main reason. But one of the things I want to talk about, especially for people who are in medical school overseas at the moment, is Although you want to come back, say you want to come to Canada, and Canada is your first choice, make sure you always have a backup plan. So if you want to come to Canada as your first choice, have your backup as either your home country, or your backup plan should be the United States. The United States, it's much easier to get a residency spot as an IMG just because the country's much larger, the population is bigger, they have a lot more residency spots that you can apply for. So the chances of you matching an American residency spot is way higher. And even if you want to eventually go to Canada, you can go to America first, do your residency training. Once you have your residency training in the United States, then coming to Canada is so much easier. You'll be able to literally walk across the border and start working here. That's not a problem. So if your end goal is Canada, but you can't get training in Canada, see if you can go to the United States to do your training, because you can always come back to Canada. The other thing about having backup options is you're not going to be as stressed as if you don't have a backup. So, for example, when I came to do my interviews in Canada, my backup was Australia. I pretty much had a training job in Australia already lined up, and I knew if Canada didn't work out, I knew I already had a backup in Australia. So in that way, I was actually a lot more calm. I wasn't stressed out. So when I came for the interview, I felt that I actually did a lot better at those interviews, because I knew that, okay, fine, if I did not get this job in Canada, I wasn't screwed. I still had a job in Australia, and I could always go back, work there, and maybe eventually come back to Canada some other way. But if you put all your eggs in one basket and you're really desperate to get a residency match in Canada, then even if you're a really good candidate, you will go to that residency interview, and literally, because this is your only option, you may do something totally stupid that you never would have done and screw up that interview, right? So make sure you have backup options so that even when you come to the Canadian interviews, you're just calm, you're not stressed out, you know that you got another option. This is just like just another interview, and then you'll probably do so much better on it too. So the next question is, recently finding that I enjoy academic teaching aspect of medicine, maybe more than clinical. If not now, if you can please let us know about IMG possibilities of doing teaching positions. So this is actually interesting. So you can actually get, so in Canada, a lot of university professors who teach medical related topics are actually licensed physicians. So a lot of so including myself. So for example, my main job is an anesthesiologist at the hospital, but I also have another title of lecturer at the University of Toronto's Department of Anesthesia. So part of my job is doing lectures for medical students or residents as part of their training. So that's how a lot of physicians in Canada already work. But if you don't have a license to practice clinical medicine, you can still work in teaching. If, for example, maybe you're an expert in anatomy and you want to teach anatomy. So a lot of people are able to get jobs at the University of Toronto as an anatomy sort of lecturer, and they don't do any clinical work, and you don't have to have a medical license to do that kind of work. It is possible. I don't know much details about how you would go about applying. I think a lot of lecturers, even if you're teaching anatomy or pharmacology, you would end up needing a master's or PhD, because not only would you be teaching, you'd also have to be involved in some kind of research. And in order to do research, a lot of universities want you to have a master's in whichever field you're doing research in, so either a master's or a PhD. But it's definitely doable. I know a lot of people who aren't licensed physicians, but they teach at the university. So the next question is, hi, I've been out of practice for a year and a half, just registered for the Mcc Qe1. Will it be a problem, and what can I do to cover the gap in Canada? I'm currently in, okay. So essentially, a gap of a year and a half or 2 years is not so bad. Again, I think I mentioned it before. If you do have a gap of in your timeline on your resume, I think the best thing to do is be honest about why you had that gap. So in your case, I'm assuming that you came from another country and you had to go through the whole visa process, and so you couldn't work. So I would sort of just highlight that and then say what positives you did in that time. And you can sort of mention things like you kept up with your medical knowledge by reading medical journals. You involved yourself with volunteer work at a hospital or clinic. You involved yourself in research. So you could turn that into a positive. So the next question is, I'm a diploma in clinical pathology. If I clear the QE1 and OSCE, am I bound to get a job residency there? So not necessarily. So you have to be realistic about this. So if you clear the QE1 and and the NAC OSCE, that is just the bare minimum that you need to have in order to apply for a residency position. And so again, once you clear the Mcc Qe1 and NAC OSCE, you're eligible to apply for Carms. But now, if you want to apply for pathology, I think there's probably about 6 spots across the country, and there may be about 500 IMGs applying for those 6 spots. So you're going to be sort of competing against them. In terms of getting a job as a clinical pathologist, you go through the practice assessment route by submitting your medical school degree, your clinical pathology diploma, your work experience to the various licensing bodies. So I talked earlier about licensing bodies. So each province in Ontario has a licensing body. So you have to approach them directly and ask them, listen, this is my qualifications. I've done a clinical pathology diploma for 3 years in India. This is my work experience. Can you assess my experience? So it's practice assessment. And they'll look at all the information and say, okay, we accept your credentials. We'll allow you to practice for 3 months in a supervised setting and have you assessed. And if they're happy with that, then they'll give you a license to practice in that province. But again, the QE1 and the NAC OSCE are basically just the bare minimum. It doesn't guarantee you a job anywhere. So the next question is, why anesthesiology? And weren't you from Australia? I'm in Australia too. So yeah. So essentially, yeah. So essentially, what I did was, for me, why I chose anesthesiology was my background was in engineering. So I essentially I did high school in Canada, and then I did 4 years of engineering in computer engineering in Canada. And so engineering is very mathematical, it's very analytical, it's very numbers based. And chemistry was one of my sort of strong subjects. So I went to medical school with an open mind. So I went to the University of Sydney. I'm not sure which school you're in. But I went to medical school with a very open mind about, just understanding all the specialties. And so I actually initially considered doing surgery, first of all. But then I just didn't seem to like the lifestyle of surgery. And then so with surgery, like I was thinking, okay, maybe doing radiology. And so I actually started doing some training in radiology in Australia. And although it seemed like a nice specialty to get into, for me, anatomy was never my strong subject because I just can't memorize anatomy. So I just felt that I wasn't going to be good enough in radiology. So eventually, when I applied back to Canada, I applied to radiology, but a lot of my research and my work experience was sort of tailored towards anesthesiology. So I ended up, when I applied to Carms in Canada, I pretty much only got my anesthesiology interviews. Like, I did not get any radiology interviews just because my application was pretty much targeted towards anesthesiology. And so I essentially only interviewed for anesthesiology jobs. And the reason why I chose anesthesiology, again, one, it's a fairly good lifestyle. Like, although you have to do on call. So on certain days, I do 24 hours of work in the hospital. So that's a little bit tiresome. The salaries in Canada for anesthesiology are pretty good. The work is interesting because it's very analytical. So there's a lot of math and physics involved, and physiology and pharmacology and chemistry involved in anesthesiology. So I found anesthesiology was just very easy for me to understand. So even now, when I go to work, it doesn't seem like a chore because everything just makes sense to me. So it just came naturally to me. So I thought that's why I chose anesthesiology. Yeah, and then the reason why I came back to Canada again was just because my family was here. So the next question is, what about possibilities of getting into residency? Is it true IMGs don't get into medical residency in Canada, or it takes ages to get into residency there? So yeah, so to answer that question, I think I answered. It was probably another question that someone asked early in the live session. Residency in Canada as an IMG is very competitive. So you essentially are competing against, so for example, in anesthesia, there's 6 spots across the country for IMGs, and there'll be about 900 people applying for those spots. So you essentially are competing against 900 people to get one of 6 spots. So it's very competitive. It's not impossible because someone has to get one of those 6 spots. So it's not impossible, but it's very difficult. You need to make sure that your application is targeted towards that specialty, and you essentially need to make yourself stand out above the crowd. So what are the ways you're going to stand out above the crowd? Good reference letters, have research in the field you're applying for, maybe have worked in that specialty before, maybe you got an award in that specialty or anything. So essentially you need to pack your CV up with as much as possible to show that you stand out above that 900 people applying. So it's not impossible, but it's very competitive. Yeah, and then there's some specialties that are impossible. So for example, if you want to do, I don't know, in some years, plastic surgery, there's 0 spots for IMGs. So in those cases, yes, it is impossible because there's no spots. If you're coming from overseas, there's no way you're getting plastic surgery because some years there are just no spots available for IMGs. So the next question is, so for practice ready assessment, do we have to take NAC, OSCE, or QE1? Generally, yes. So each province has a different practice ready assessment program. So if you want to get the details for each province, then I would suggest going to those specific province and look up. So if you want to work in, say, Alberta, go to Google, type in Alberta Practice Ready Assessment, and you'll go to the link for the Alberta College of Physicians, and they'll give you the information about what sort of items you need to submit in order to get practice ready assessment. But in general, to get a license to practice medicine in Canada, you need to go, and one of the requirements is You need to have a medical license in that province. The other thing is you need to have, I don't even know how to describe it, you need to have the Medical Council of Canada license to practice as well. So the Medical Council of Canada is what offers these Mcc Qe1 and Qe2 exams. And it's almost a redundant system, but you need to have the NAC-OSCE and Qe1 to get Medical Council of Canada license. And that Medical Council of Canada license, you need to enable to get a license in a specific province. So it's a very, very strange system they have in Canada. There are three main bodies that you need to sort of appease. One is the province's licensing authority. So, for example, in Ontario, it's called CPSO, or the College of Physicians and Surgeons of Ontario. So they're the one who give you the final license to practice. If they don't give you a license, you're not allowed to touch a patient. Okay. The second thing is the Medical Council of Canada, which runs the NAC-OSCE and the Qe1. They also give you a licensure of the Medical Council of Canada. You need that certificate to apply for a license with CPSO. And then the final one is if you want to be a specialist or a specialist family doctor, is the Royal College of Physicians and Surgeons of Canada, or the College of Family Physicians of Canada. So those two bodies essentially say that your training is equivalent to a fellow of the Canadian, one of the Canadian colleges. So those are the three sort of bodies that manage your medical credentials and licensing in Canada. So the next question is, so what is the provinces that recommend that the candidate must be resident there? So, so in order to apply for Carms, you need to be a permanent resident. So that's pretty much all the way across the country. In order to apply for Carms, you need to be a minimum, either a permanent or a Canadian citizen. So that's the bare minimum. Now, there are certain provinces that want you to be also a resident of that province in order to apply for Carms. So the two that I can think of off the top of my head are British Columbia and Alberta. Now, I may not, there may be other provinces, but off the top of my head, I remember when I applied, I did not even bother applying to British Columbia or Alberta, just because they said you needed to be a resident of that province to apply. So I just didn't even bother applying. So the next question is, it may sound silly, but do letters of reference from South American countries count? So letters of references from any country count. So if all you have is a letter of reference from Brazil, then that's all you have, and you can apply, and they're not going to reject your application based on the fact that all 3 or 4 of your reference letters are from Colombia or Brazil. So that's not a problem. They do count. But are they going to be competitive is what you need to be asking yourself. And if there's a candidate applying beside you and that candidate has a Canadian reference letter, that candidate is going to look much better on paper compared to you because you don't have a Canadian reference letter. That Canadian reference letter is going to be that physician that wrote that Canadian reference letter is going to be able to compare that candidate with an equivalent Canadian resident and say that this person is very good. They're at the level of a Canadian medical graduate, and so I could highly recommend this candidate. So So yeah, to answer your question, yeah, South American references do count, but they just don't look as good as having at least one Canadian reference letter. The next question is, I've graduated in 2014. Is that okay if I give the exam and apply for Carms? So again, there's no limit or restriction of when you graduated, but the further away you are from graduating medical school or clinical medicine, the less chance you are going to have in order to match to a Carms residency program. So if you graduated in 2020, matching as an IMG to Carms is hard enough. And your year of graduation gap is going to be pretty much 6 months or 1 year. That in itself is hard enough because you're competing with maybe 600 other graduates. If you graduated, for example, in 2004, you're now seven or 8 years away from medical school, and you're now competing with people who may have graduated in 2019, 2020, or 2021. And just looking at that in itself, those people who graduated more recently just look better on paper. So it's not impossible. If you have amazing letters of references, if you have amazing research, if you have amazing awards that you've received, those could counteract the fact that you graduated in 2014. But just going by year, the longer you wait, the harder it is to get matched into a Carms program. So the other thing you could, so I'm not sure what the next question is, recent practice in your own country. So recent practice in your own country only works if you're going through the practice assessment route. And in order to do that, you need a proper postgraduate qualification in some specialty. So for example, say you did a postgraduate qualification in anesthesia in India, and you have some work experience, you could try and get that assessed, and maybe you could get a license that way, but it's never a guarantee. So the next question is it possible to apply to different universities for the same program? Yeah, so essentially when you apply through Carms, Carms is an organization that is not involved with selecting candidates. All it is a organization that distributes your application to different universities. So when you want to apply, or say you want to apply for internal medicine, when you go to Carms, you sign up on the website as an applicant, and then you select that you want to choose internal medicine at these 5 different universities, and you upload your application into an electronic database. So you upload your CV, your reference letters all go into that system, and then electronically Carms will send out your application to the 5 different universities you've selected. And yeah, you can apply to internal medicine at 5 different universities. You don't even have to apply to one program. You can apply to internal medicine, anesthesia, radiology, pathology if you want, at all the different programs, because all of those different programs are all totally independent. They don't know that you applied anywhere else. All they see is an application coming to them. The next question is, how about gay doctors there? Are they well respected? So yeah, if you're gay, if you're homosexual, Canada's pretty open. You don't have to list. So I think in a lot of countries you have to say your gender on your CV. Here, you don't have to label your race, your gender, your religion, any of that. You don't need to put that on your application. All your application is based on is your education and your credentials. So yeah, it's pretty open. I don't think they discriminate in Canada. Okay, guys, so it's been about an hour and a half. If I guess we'll wrap it up there. If you have any other questions, please feel free to send me a message on as a comment. I've had a lot of messages come as comments recently, so I'll try and get back to you guys as soon as I can. I haven't had a chance to respond to a lot of my messages lately, but I'll try and do it over this next weekend. If you do have any other questions, please make sure you send a message, and I'll try and do another video or do another live stream maybe in about a month or so. Because I think if I do a live stream too frequently, then it just gets a bit boring and people run out of questions. There's another question: how to get PR before applying to residency. So, to be honest, I don't know the exact details of how to go about getting permanent residency, just because I haven't had to do that. I've been a citizen in Canada since I was about 10 years old. But the best place to probably go is you should be able to either visit the Canadian Embassy website in your home country, or you can just Google Canadian permanent residency or Canadian Embassy, and you should be able to get generally enough information to sort of answer your question. In general terms, people do migrate to Canada using a points-based system. So if for example, your medical specialty, so for example, say you're a pathologist and pathology is a required specialty in a certain province, they may be able to expedite your PR, but that doesn't necessarily mean that you would get a license to practice. That just allows you to sort of come into the country, but then you still need to go through the practice assessment route. What most people end up doing is they migrate to Canada using either the points-based system, or if they have a spouse who is an engineer, sometimes an engineer may be able to migrate into Canada as a permanent resident, and then they sort of come along with their spouse, and then they end up applying either to residency or practice ready assessment. So one last question. I'm from Algeria and I'm in fourth year surgery resident in my home country. How can you pass residency in Canada? So generally, if you're coming from Algeria and you finish your residency, you may be able to do a practice ready assessment. But again, you need to submit all your qualifications. But in general, from my experience, if you're coming from an African country, it's very difficult to get your credentials approved in Canada. You may need to reapply to a residency program in Canada and start from scratch. So last question again, Mcc Qe1, do you know any good question banks? So the question bank I pretty much used was the Canada Q Bank. I pretty much signed up for it in my fourth year of university for the full year. I think it was about $500. And I pretty much used the Canada Q Bank. The other question bank that I would recommend is UWorld, which I think you can sign up for a year as well for about $400 or $500. Those are the two that I would recommend. I personally haven't used anything else, but for me, the Canada Q Bank was enough to essentially allow me to get a really good mark on the QE1. To be honest, I don't know the difference specifically between anatomical pathology and general pathology. I think at the end of the day, they're going to be the same program. I think McMaster has, in the same university, there's anatomical pathology and general pathology. To be honest, I don't know the specific difference. The best thing to do is contact the program and find out, and they'll be able to give you a direct answer. And at the end of the day, you have to realize Canada is a very open country, and the best way to just get information is ask someone. So if you are in if you're in an observership or an elective, just don't be scared to ask questions. That's pretty much the best way you're going to get a good, honest answer. Okay, guys, so thanks very much for joining me on this live stream. I really appreciate everyone submitting questions. Hopefully I was able to answer most of them. And I'll see if I can maybe reschedule another live stream in maybe in a couple of weeks, maybe in a month or so. So thanks again, guys. Make sure you share this channel. It's still pretty early on. And if you have any ideas for any other videos that you may be interested in seeing, please let me know, and I'll do my best to put those videos together and get them out. All right, thanks, guys. Good night.